Hi, I'm Dr. Rohit Arora. I'm a pediatrician and neonatologist at Cloudnine Hospital, Golf Course Road, Gurugram. Fever in newborn babies is still defined the same as it is defined in the adults, that any fever above 100.4 or 38 degrees centigrade is what is called fever. Now, newborns generally don't develop fever except in certain situations, which I'll just talk about. But the temperature can go high in healthy babies because of the environment primarily, is what we see in our practice quite regularly. That parents tend to overclothe the babies too much. They keep the environment very warm, thinking that kids can get, cold, cough. So they keep the environment very warm. They don't put on the fan, especially in the north of India. They don't put on the AC, thinking, fearing that baby might develop cough and cold. So babies tend to warm up and overheated actually at times, and all that is required is to improve the environmental temperature, loosen up the clothes and give feed to the baby. However, in certain situations, fever can be a pointer towards underlying infection as well, just like any other infection in other age groups. But the milder infections in newborns actually don't always produce fever. It produces actually low temperature. So when the fever is there because of infection, you should always be wary that it can be some severe infection, right? So that's an important point to note. Or it can be a pointer towards brain infection, which we call as meningitis. Or rarely, it could be a reason of an underlying malaria in newborn, which is very rare these days actually. So fever, most common reason is environmental. It could be an underlying severe infection, or rarely it could be congenital malaria or so. How to recognize what it is? Now the baby, if otherwise healthy, feeding well, there's no other reason for infection. Baby is not lethargic, crying profusely at times, but otherwise smiling as well. These are pointers that it's likely environmental. If baby is lethargic, not accepting feed, urine output is also down, baby looks sick, these are pointers that there is something else also apart from the environment, and you should look into it, and such babies need to be investigated as well. In terms of management of such fever, first thing is to loosen up the clothes, improve the environment and recheck the temperature. If it is still 100 plus and baby is dull and lethargic, yes, you should investigate and use paracetamol drops as required. So to summarize, fever in all probability it's likely environmental, but if there are other clinical features, then such baby should be investigated for an underlying infection. Thank you.